5 in the afternoon here on 90.3 FM, the Talk to Me Network. John Harper with you. And since it's Wednesday, that means it's time for Helping Seniors of Brevard. Let's get things going as we introduce the host of the show and the Executive Director of Helping Seniors of Brevard, Kerry Fink. Hi, Kerry.
Thank you, John Harper. I'm Kerry Fink, and welcome to today's edition of Helping Seniors Radio. It's always a pleasure to gather around the radio on Wednesdays. It's lunchtime hour for Helping Seniors Radio, and this is the gathering spot right here on 90.3 FM. WEJF. Also want to say welcome to all the listeners who find us online at WEJF.net, and a special hello to those who catch us as a podcast, because actually since the start of the year, the Helping Seniors organization has been making Helping Seniors Radio available in the podcasting world. And so that means actually wherever you get your podcasts, whether it be Apple and iTunes, or you go to Amazon and say, hey Alexa, or maybe you're Spotify or your iHeartRadio. It really doesn't matter. Or Facebook. A lot of people are catching us on the Facebook podcast as well. And some still go to, it seems a little bit old fashioned now, YouTube, but we're there. We really want to work hard to get information in your hands that's going to be of good value to you as you work on your own aging plan. And as you know, our president and founder, Joe Steckler, has always been a strong advocate for seniors. And one of the people that has been kind of next to him literally all of the way is none other than our guest today, longtime friend of Helping Seniors. It's Dr. Lee Sheldon, noted area periodontist with Sheldon and Furtado, PLLC. Did I say all that technical stuff right?
Boy, did you do well, Kerry. That's fantastic. Yes.
Yeah. And how are you doing today, sir?
I'm doing very well. And how are you doing?
It's good. It's always fun to be on the radio. And, we talk about this. John Harper was the guy who got Joe Steckler started on radio, but you're the guy who got him started on TV. And what a difference that has made. We were filming Helping Seniors TV. Some new episodes are coming. And so we were literally busy recording some of the TV episodes. And we were talking about that it actually turns out that we are now moving into year 12. I've always been saying it wrong, but since we served seniors in Brevard in beginning in 2011, Nancy Deerdorf, our operations director, she did the count on her hands, and we figured out, wow, we must be actually moving into year 12 of this. So anyway,
we used to have our initial meetings right here where I'm speaking from.
She was telling me that. She said you guys would meet. She goes, we started out at Dr. Sheldon's office, and we were meeting there. And wow, it's made such a big difference, Dr. Sheldon, over these years, because we were talking about this yesterday. She's getting 300 calls a month now. That's
wow.
That's what's happening with this senior information helpline. And what in her experience is, she's saying the need for helping seniors is only getting more evident day by day. Just one aspect is watching the numerics of the phone calls. And it's all this stuff. It's housing, it's transportation, it's medical, it's financial. And I guess you could rack it up to several different things. We've all been through COVID, that whole season with COVID. People are moving to Florida right and left. And the other thing is, just on a good day, we're all getting a little bit older. So there's more seniors every day, Dr. Sheldon.
Well, I got to tell you that, I can't think of a better person with a better background than Nancy Deerdorf. I mean, here, Nancy's a nurse. She's gone and worked in administration. She's worked in seniors areas in her professional life. So, we're lucky. We're really lucky to have Nancy in the position she's in.
Yeah, we are. We're so blessed. We talk about it. I like to brag on her. She has 33 years of registered nursing experience, and then she goes on and manages one of the most respected, best home health care agencies in the area. And she served, as with Joe on the board of directors since the day Joe started the organization. And then last year, she says, I could manage to come over and help you guys a little more, which is exactly what the doctor ordered.
Exactly right. And I bet you she's one of the reasons for more phone calls too.
Yeah, no, it's good and it's important because, as you know, helping seniors, even you, because your background, you go back with Joe when Joe was building the Joe's Clubs and getting all that going with Brevard Alzheimer's. But I remember when I first met Joe, and he said, "Listen," he said, "I've come to the conclusion that seniors have issues that go far beyond memory care. Many seniors have, there's everything's good on that front, but they're hitting other challenges, and we need more help to figure out how to do that." So Joe, as you know, he's the fearless campaigner for all things seniors, and the kind of the battle cry right now is this thing about affordable housing, Dr. Sheldon, because what's happened is the great news is if you own a home in Brevard County, your property values are way up and stuff like that, but it is causing a squeeze on seniors with fixed incomes who may have been renting for a long time. And now then they're getting hit with all these challenges of the fact that you just can't find something you can afford to rent in our area.
Yeah, you wish that everybody's good news was everybody's good news, but in this case, good news for one can be bad news for another. And of course, one of those problems is housing costs. Now, the problem is food costs. I mean, we've got a real inflation that we haven't seen since the beginning of my professional career, which was in the 1980s.
Yeah. I remember Joe's often talked about that he bought his first home in the middle of that 18% kind of interest rate inflation that was happening back in the day. And Lord knows, I hope that's not what we're in for. But on the plus side, we're tackling it. It's part of the advocacy of helping seniors. And so from our local perspective, because we're 100% local here in Brevard County, we've actually set aside our radio program for March the 16th. We've invited some of the folks from the Brevard Commission on Aging, who also very much recognizes the challenge. In fact, they want to advocate a lot with our county commissioners to say, hey, while you're busy with everybody's property taxes and things like that, you need to recognize maybe some of the challenges that creates for seniors. Because if they own their home, now they're having a bigger fight just to pay maybe their property taxes. But it squeezes the renters because obviously then the landlords are passing that back through. So it's complicated. But, Joe, Dr. Sheldon, he's not afraid to tackle it. He's doing the articles and hometown news and just trying to drum up awareness so everybody can get on that bandwagon and make sure that we at least understand it's a challenge and we need to figure this out together.
Yeah. And I want to emphasize that just because you don't hear Joe on the radio very much anymore doesn't mean that Joe isn't fully involved in what's going on. He's just got, what should I say, bigger fish to fry?
Well, I was going to say the pen could be mightier than the microphone. I don't know. But Joe is very, very much active with that. And so it's important. But actually today, what we wanted to tackle was, as we've been talking about inflation and things like that, you and I did a radio show together a few months back where it was called about the have-tos and the want-tos. And I think today we were talking that we want to kind of carry that discussion a little bit further. And the question that is kind of a provocative title, but it's, does dentistry have to be expensive? And I know that's probably going to be a complicated answer because everything is getting more expensive. But where do we start with that, Dr. Sheldon?
I think when we talk about that, even when you're seeing somebody like me, and we're known for being a high-end office, that doesn't mean that we always see high-end people who get the dental implants and the fancy bone grafts and everything else. That we've got to be able to look at dentistry as an elective procedure. We've got necessities that's often covered by medical insurance. Dental insurance doesn't cover very much at all. And sometimes dental insurance is geared towards certain procedures that we don't need. And so that when we're looking at this kind of a procedure, we very much got to look at it. I'm talking about from my perspective. I just got done with the patient. And this patient does, she's means. She can pay for things, but still the things that are going on in my mind, and she needed a high-end work, is what do we really need to spend money on now and what can we defer? What can we get away with in order to be able to give you the result without overstressing the budget? It's got to be uppermost in my mind, if it isn't uppermost in the patient's mind as well, because I'm, on one side, I've got to be the doctor type, but on the other side, I have to be an advocate for that patient so that we don't spend too much money and that we get the result that we want. But even in my high-end work, which is the dental implants, that's always the most expensive, or crowns and those types of things. Then there's the other end. And I saw a patient just before that patient. And this patient has very little money, is getting some assistance from other sources, yet she's seeing us at least for advice and maybe for some treatment. I've got to be able to tailor the treatment for that as well. So where a dental implant is placed or a series of dental implants is placed to provide teeth that are as close to natural teeth as possible, there still is the old procedure, which is still commonly done, and that's the partial denture, something that snaps into place that doesn't have nearly the same cost and can provide, while not as much function as a dental implant, can be serviceable, allow you to look good, and perhaps even allow you to stage procedures so that you can go to a less expensive procedure now, giving yourself something you can chew or at least smile with, and then prepare for the next stage if, in fact, you can afford it, to go to some of the dental implants later on. So there's got to be some long-term thinking, both on the patient's part and on my part, in order to be able, and not just my part, I'm talking about any dentist's part, in order to be able to give a patient the result that he or she is looking for. Yeah. I'll go back. I'll make this a little bit more of a monologue, Kerry, and then by all means ask questions. When I got into dentistry, in the mid 70s. That's when I went to dental school, and then I came to Brevard County in 1980. Periodontists were only recognized as a specialty since the mid 60s. That means the science of saving teeth is about 50 years old. Now, it doesn't mean people weren't doing periodontics. The American Academy of Periodontology goes back to the early 1900s. But in terms of the thought process where people said, I'm going to save my teeth rather than get dentures, that only began in the 1960s for most people. So the old solutions, which were dentures, and what was common at that time was, I'll hold on to my teeth as long as I can, and then when I have my teeth, and then when they get too bad, I'll extract my teeth and put in dentures. That still is a fact of life today, and it can be done. And while it's not as good as some of the fancy things we do, I've gotten plenty of patients through that early stage with dentures in order to be able to get a better job or to be able to have a better social life or whatever it was to make the teeth look good. And then they could stage it to go to something newer and better. But we don't necessarily dismiss the old technology. Just like we don't, in medicine, we don't dismiss the old medications just because a new medication has come out. Sometimes older is better for many people.
I was thinking as you were talking about that, because we just finished up a radio show not long ago, and it's a topic that we've actually covered a couple of times, where we have talked about that while you were actually I kind of call you like a father of dental implants along the Space Coast, because you kind of pioneered the way. But we've also done a lot of programs where you said, hey, that's not necessarily always the best answer. And I guess that probably comes from your perspective as a periodontist. So I remember we were just talking about on the radio fairly recently about how important it is to really understand what's going on in the mouth, and to try to save teeth could be more practical and perhaps more cost effective, at least in the near term, where that's prudent to do so. And so what I wanted to ask you about that was, when a patient comes in, how do you look at trying to determine what's the best route that's going to give the patient the best long-term solution? Because I also remember you telling me like, okay, everybody just has this assumption because we see these TV commercials like, oh, I just take my teeth out, I put these implants in, and everything is just going to be perfect for the next 40, 50 years or whatever. And you've said, you know, it's a solution, but it's not always the solution.
No, it isn't. I think we've got to make sure that we're looking, and we talked about this, the have-tos and the want-tos, but that's okay because it does fall in line with what we're talking about today. Mm-hmm. In periodontal disease, that means we're losing the ligament and the bone support for the teeth, and the ultimate result of that infection, and it is an infection, is the teeth get loose and come out. We have an errant assumption, and it's not among patients. Unfortunately, Kerry, it's among dentists.
Wow.
That once you have periodontal disease, there's nothing that can be done, and you're eventually going to lose your teeth anyway. Our problem in periodontics right now is educating the profession to let the profession know that, in fact, teeth can be saved, and they can be saved for a lifetime. I think as we're looking at patients and we have this assumption of a one-way infection, that all that's going to happen is the teeth, no matter what you do, the teeth are just going to get worse and worse and worse, and eventually those pockets are going to get deeper, and when the pockets get deeper, there'll be no bone support and the teeth will come out. There have been so many advances in diagnostics and so many advances in treatment that the answer to that, but for most treatment, for most patients, is that assumption you're going to lose your teeth because of periodontal disease, that's not there anymore. Oh, there are a few. I mean, I saw a person who's failing yesterday. So, but I might see, and there's very little we can do, and we're working and we're trying to come up with more unique solutions. But that's a handful every year, and I'm a full-time periodontist. We're a full-time periodontal practice. So, and by the way, if you have periodontal disease, that's the cheapest way of treating your teeth. If you just have periodontal disease, you know, that's less expensive to treat periodontal disease than to extract all your teeth and make dentures. And it's certainly a ton less expensive than to do dental implants. So we've got to look first we've got to think of ourselves as doctors. We've got to think of ourselves as infectious disease doctors. And if we can rid the body of that infectious disease, which can be antibiotics, it can be deep cleaning, it can be all sorts of different things that enter into the hopper as I'm thinking about a patient. If we look at that, boy, we could save a lot of people from extracting a lot of teeth. And as soon as you've extracted a tooth, boy, that's when your expenses go up.
Right, because that's the main topic that we're after today. We're talking about, does dentistry have to be expensive? And we're talking with noted area periodontist Dr. Lee Sheldon. So, like, that's a good question. So the patient comes in, and I know this is an opportunity for me to pitch a little bit how you can help, as a listener, help us in helping seniors, because it's a fundraiser. But I know you've talked a lot of times. I think you call it your charitable giving program or something like that. But I remember that you really want to take time with a patient when they come in, because it's so important for you to be able to get the best treatment plan together for that patient that makes the most sense, that fits all the things. And yet you found a way to actually make that benefit charities like us here in Brevard County.
Yeah, that's so good. It's so good. And by the way, we gave it a new name last year, but I'm not using it very much. It's Solid Bite Gives Back.
Okay.
That came from Ken Zutko, who we work with for public relations. But we call it the charitable giving campaign, yeah. Solid Bite Gives Back. It's essentially, listen, we want to see you for the examination. And we want to benefit charities at the same time. We have 6 charities in our charitable giving campaign. Helping Seniors is one of them. Somebody listening to this program would be donating to Helping Seniors, I hope. And so all you do is call the office and say, listen, I heard Dr. Sheldon on Helping Seniors Radio. I want to take advantage of that charitable giving campaign thing, whatever you want to call it. And what Jennifer will do, will talk to you about how you can do that, which essentially bring in a check for $50 or more, writing to Helping Seniors of Brevard, give us the check, and you get the examination, the CT scan, the x-rays, all at no charge.
Yeah, it's a great value for us as the consumer coming in. But what I remember you really talking about too is why it's so important, because you feel that it's so important to spend that time with the patient to get to really have all the data, I guess, all the information you need to really help them figure out how to do this. So in the best possible way. So again, if somebody wants to participate in that, how would they reach you to just get more information and maybe set up that appointment?
Just call us at 321-259-8000. Okay. 321-259-8000 and talk with Jennifer. Actually, talk with anyone, but you're likely going to talk with Jennifer and she'll lead you in the right direction.
So as a patient would come in, however they come to your office, you're going to really look at that situation for them and figure out a treatment plan, right? Like, so I have a question. Like, is it a static treatment plan? Is there just one? Like, I come in and you say, well, here's what you need. That's it. Or how does that work?
I have to look first at the entire picture. I have to look at your health history. I have to look at the acid level in your mouth. People you and I haven't talked about this, or maybe we haven't for a long time. Do you know some people are carrying around an acid level that totally demineralizes the teeth? And no matter what we do, the dentistry is going to fail. I've got to look at that because I don't want you to spend money with us and then say, oh, gee, the teeth decayed again. I wish we had known that. So I've got to look at the acid level. I've got to look at the medications you're on. I've got to look at the typical things we'd look at, which is decay and periodontal disease. I have to look at the relationship between teeth. I have to make sure that all of the teeth are meeting correctly. I have to look at what you want. I have to look at the aesthetics. I have to look at your ability to chew. I have to look at your bone levels. I have to look at your periodontal disease status. I have to look at the amount of bone available for dental implants. I also have to look at what do I see is the long-term picture? What's going to happen within the next 20 years? And while we may not be doing all of that work now, for the next 20 years, I have to factor into my head whether it's worth spending money on tooth number 6 when tooth number 5 may go bad tomorrow or in 3 or 4 years. So I've got to be able to plan strategically so that when you invest something in your mouth, it's going to be a long-term investment, even though we're not going to treat everything right away. All of those ideas are what are the factors that go into my head as I'm trying to develop a treatment plan that's going to be worthwhile for you.
You know what's so fascinating to me as I hear you talking about that is I think most of us routinely don't think much past the immediate moment, like, oh, I've got a toothache. Oh, I don't like the way these teeth look here, or we have some like surface level of objective. And I'm not saying that's not important, but it's interesting to hear that you're actually looking at it kind of as a long-term scenario, like over the patient's life,
I do. I mean, if the patient has a toothache, we got to take care of the toothache in one way or the other. Either we're doing a root canal or extracting the tooth. We've got to get the patient past the emergency stage. Right. And even when we're doing that, I have to decide, is that tooth worth saving, or are we better off extracting it, moving to the next stage? So I've got to see you in order to be able to make that recommendation. But that's the immediate need. That's the emergency procedure. Once we get through the emergency, then it's a matter of looking at long-term planning so that you can understand what's going to be done. And when you're planning expenses, to understand what you're going to get for that dollar amount, or whether it be a low dollar amount or a high dollar amount, in order for you to be able to plan correctly. And that's what's factored in. When we're talking about expense, there are always the least expensive procedures to do. That's different from seeing the least expensive dentist.
That's a valid point. Well, we are having this conversation today with Dr. Lee Sheldon, noted area periodontist with Sheldon and Furtado, PLLC.
I am the employee. Remember that?
Well, yeah, I guess that makes your son the boss, right?
Yeah, I think it depends on the day. It's either Dr. Furtado or my son who are my bosses. Yes,
that's terrific. It's good. And our topic today is: does dentistry have to be expensive? And we're going to continue this conversation with Dr. Lee Sheldon right after we take our mid-show break here on the Helping Seniors radio show. Make sure you tell your friends about Helping Seniors Radio every Wednesday, 12 noon on 90.3 FM WEJF. The audience keeps growing. The station is a strong station, covers all throughout Brevard County and well into Indian River and actually over into Orlando. So share the good information, good senior information with your friends. We'll be right back after this mid-show break for more of Helping Seniors Radio.
And it's Wednesday afternoon. That means Helping Seniors of Brevard is on the air, on the radio. And let's get back to more of today's show, an interesting topic, as we say hello again to the host and executive director of Helping Seniors of Brevard. Here's Kerry Fink.
Thank you, John Harper. It's a great Wednesday. Always fun to be on the radio with Helping Seniors Radio. And our effort is to give you good information that helps you. We call it these days getting your ducks in a row, but it's one way to talk about what Joe Steckler, our president and founder, has really talked about from day one. And that's getting your own aging plan in place so that you can make good decisions and really enjoy your best life you can as the years come along. And so welcome back to the second half of the Helping Seniors radio show every Wednesday, 12 noon on 90.3 FM WEJF. And we're continuing our conversation with Dr. Lee Sheldon, noted.
Can I tell a secret, Kerry?
Go for it.
We're celebrating Joe and Terry's 50th anniversary.
That's right.
So happy anniversary, Terry and Joe.
That's right. That's actually happening on or at least
it already happened.
Oh, okay. Well, happy anniversary. Is there a song we sing or something like that, or we just acknowledge that? You know, Joe is such an interesting individual because we actually did a Helping Seniors TV show yesterday. Nancy Deerdorf and I did together that will be coming out on Space Coast Government TV very soon, and obviously available on our YouTube channel and so on and so forth. But we were talking about really the history and the legacy of what Joe has done here in the Space Coast. You know, his last command, we always like to call him the submarine commander because that's what he did early in his career with the Navy. But he always talks about he's a retired captain with the Navy, and his last command was for the Navy's retirement home there in Mississippi. And I guess when he and Terry retired and decided to be close to Patrick Air Force Base and Satellite Beach and make this their home, then Joe can't be retired. So he goes off and gets things going with the Brevard Alzheimer's, gets those Joe's Clubs built, retires from that, and he can't stay retired. So he goes and gets things going with Helping Seniors. And it's fascinating to think that now we're moving into our 12th year of service here in Brevard County just with that. And
it's true. And you never see Terry, but Terry's always there. She's always supporting Joe. She's always working behind the scenes to help Joe. There's such a great team together. So happy anniversary to both of them.
Absolutely. And I got to tell you this story. Our youngest daughter, Anna, when she first met Terry Steckler, Joe's wife, and I said, well, what do you think of Terry? She goes, oh, she's great. She reminds me of my grandmother, only she's nicer. So there you have it, folks. So happy anniversary, Joe and Terry. So, but our topic that we're really trying to zoom in on today for the benefit of listeners is, and it's a question, you know, we're all confronted every time we go into the grocery store. Everything seems more expensive. We go fill up at the pump. It seems like it is more expensive. But the question that we're trying to tackle today is, does dentistry have to be expensive. And so we spent some part of the early part of the show talking a little bit about how you get really engaged with a patient's history to try to help them make a really, I would call it almost, you call it a treatment plan, but I would call it a treatment plan for life.
It is. And of course, that's what Joe has been talking about ever since he started helping seniors, is to develop an aging plan. Well, unfortunately, one of the aging plans is dentistry. You can't get around teeth. I mean, you need them to smile, you need them to chew. But before you're able to understand what you need to be able to budget for that, whatever it is. And so that does need to be a part of your aging plan, just like medical needs to be, like legal needs to be. Some of these things are predictable. Some of these things are not. Frankly, I think in dentistry, legal is relatively predictable unless some family situation suddenly blows out of proportion. But if we're looking at medical, there's a lot of surprises in medical. The good thing about medical is that for the most part, Medicare or insurance is going to cover it. But in dentistry, it's not. People talk about dental insurance, but dental insurance is very fixed, and it's a very low number. So you can't plan on dental insurance covering your problem. But the good news is that with good diagnosis, a good diagnostician, somebody really looking at the entire mouth, that prediction can be made in advance. You can make a decision as to what your long-term budget is and know that if you spend this amount of money, and I'm putting my hands intentionally apart, then you're going to get this and it's going to last for a lifetime. Or you can spend a smaller amount of money and still know what you're going to get for a lifetime.
I wanted to ask you about that because I was going to say, as a patient, do we, like if we go to the elder law attorney and say we want to work on this, we have some input there. Do we have input as a patient when we come to your office?
Yeah, it's interesting because I have 3 treatment coordinators. I've got Laura, I've got Joy, and I've got Jill. And essentially, they take their positions very, very seriously. Not positions in terms of talking about dentistry, but acting as the patient's advocate. It's so interesting. And it started with Danielle, and Danielle. Danielle's been the office manager here for, I won't say how many years, and Danielle started with me as a surgical assistant at the beginning. Never would I have dreamed that Danielle would be the person that she is now, national consultant and all the things that she does. But it was very interesting at the time what occurred. And it bothered me a little bit, Kerry. It really bothered me until I got past it. Finally get past anything. With Danielle, you can get past it pretty fast because she's so friendly, so nice.
Yeah.
When I would start talking about what needs to be done with the patient, Danielle would start asking me questions. So wait, what's this? What's going on here? A dental assistant is asking me questions. Let me just say what I need to say and get done. And it didn't take me too long to realize that Danielle was asking me, the patients, the questions that were in the patient's mind.
Wow.
And that's what now Danielle is the manager now. She and I don't work together at the chair, at least not very much. But that's the whole idea is when Laura's there, Laura's going to ask me, what happens if she does this? What happens if she does that? Jill enjoy the same way. So that, because, patients are embarrassed. Oh, they don't want to sound, they don't want to sound stupid or whatever it is. So they don't want to ask questions of me or they don't want to waste my time, whatever it is, whatever's going through their mind. And so instead, I've got 3 assistants who are pumping me with questions as I'm making my recommendations in order to be able to answer the patient's question without the patient asking the question. I think It took me a while, by the way, for me to understand that and get past that. But frankly, if I can't give an answer to that question, what am I doing for that patient?
Right.
If I can't answer the question, or it's because I said so, or that's what you need, what does that mean? I should be able to explain everything in easy to understand language, just so that you can understand why you would do it. Or maybe once you understand why you would do it, you say, well, I don't want to do that. That's got to be there. So there's got to be that give and take. I think my treatment coordinators actually are more important than I am, because I'll feed them the information, I'll categorize the information, I'll prioritize the information, and then they can organize it for the patient. But if they're not doing that with your dentist, you can ask the dentist the question. Sometimes dentists don't answer the questions because they don't know what the questions are. Right. We're all in our own little world. We think everybody knows what we're thinking, and we don't. So part of the onus, particularly when we're talking about expensive dentistry, part of the onus is on the patient to ask enough questions that it's totally clear, rather than saying, well, he said this or he said that. It's totally clear, so they can understand how they want to prioritize their dental care as well.
What you just said, I think, is so important, because I hear this over and over. I guess for most of us, going to the dentist's office is sort of intimidating anyway, because our whole life we've been sort of afraid of pain. And somehow that's an image that comes up when we often think about, like, I've got a toothache, now I have to go to the dentist. So it's not really always a super pleasant experience, at least as we build it up in our mind. And then, because we don't even know what we're doing once we get there, we're not even sure we know the right questions to ask, which is what you're speaking to, is why it's so important that you have somebody that's helping you figure out, what are the options that make sense, and how you can manage that according to whatever time frame, budget, and things that you have available to work with.
It's true. We just got a review, and now I'm bragging about us a little bit, but we got another review, and we're getting an awful lot. They're so professional. I am upset with part of my profession that becomes the salesmanship type of thing, and you don't need salesmanship. I mean, you do need communication skills, but we've gone in the other direction in some aspects of profession when it comes to the ethics of dentistry, if you will. As a matter of fact, we just had a discussion in our staff meeting this morning about ethics. We have 49 rules for practicing in our practice. Wow. And we went over those, went over 35 of them today. We got another 14 left. But part of this is acting as a professional, and for the patient to have the confidence in the doctor as a professional. And there are lots of professional dentists right here in Brevard County who have that, who understand what a patient's needs are, who look for the patient without looking at the dollar sign. If you have a dentist like that, boy, you're a winner. Just stay with that dentist.
No, I love how you're saying that. Now, so first of all, I want to thank you, because I know you've got patients to see and things to do, and I appreciate you taking time out of your schedule. There's one other thing I want us to touch on before we head out. We've titled this, we're talking with Dr. Lee Sheldon, noted area periodontist with Sheldon and Furtado, Solid Bite Dental. And we're talking about, does dentistry have to be expensive? And I have to ask you this before you head off to see the next patient. You are known for your expertise. You do a lot of high-end dentistry. I'm talking about like cosmetic work. We've done a TV show called The Perfect Smile and some things like that. But do you only do expensive work, or how, as a person, who should give you a call?
No, we don't. We just had somebody here who goes to Brevard Health Alliance for help.
Wow.
So she may never get any dentistry done, but at least she has the opportunity of listening to what I have to say and helping her plan out her treatment, some of which will likely be with Brevard Health Alliance. Maybe some of it will be with us. Uh-huh. Yes, we're known for high-end work, but we're known, Matthew and Michelle, the two doctors here. really, really top quality dentists, but it's also, I'm looking out for you. That's what you want. I'm looking out for you. You have that, you're going to be fine.
Yeah, absolutely. And I want to, just before we close and you get to head back to the practice, I wanted to ask you to share one more time, Solid Bite Gives Back. How can we take advantage of that, or how?
Solid Bite Gives Back means that you donate directly to Helping Seniors in Brevard. To get our examination done. So just give the office a call, 321-259-8000, and we'll talk to you about the Solid Bite Gives Back, $50 to Helping Seniors in Brevard. And you get all the x-rays, the CT scan, and maybe some time with me too. No, definitely a lot of time with me too. And we look forward to seeing you here.
Yeah, we're gonna shift gears, and we're gonna talk a little bit about some of the events coming up on Helping Seniors. But I want to thank you, Dr. Sheldon, for being here with us today to share on Does Dentistry Have to Be Expensive? So thanks again for being here for that.
Great being with you, Kerry. Talk to you again next month.
You know, to me, it's always fascinating to have that opportunity to speak with experts. You know, as we do Helping Seniors Radio right here, we always have an opportunity to get some of the really, I call it the best help in town. For years, you've heard, for example, on the Helping Seniors Radio show, you've gotten familiar with the expertise of board-certified elder law attorney Bill Johnson. He's been another one like Dr. Sheldon, who has really worked together with Joe over all of these years. And he always brings a fascinating perspective to the Helping Seniors Radio with good information that we should know about as we're creating our own aging plan. And in particular, he's the one that you hear every first Wednesday of the month. He joins us here. The second Wednesday of the month is always Dr. Lee Sheldon, and he always brings fascinating topics that we should be considering, like we were talking about today. Does good dentistry have to be expensive? And then we, third week, another longtime friend of the Helping Seniors organization. Next week, you'll want to be here for this one, because this is a very special occasion as well. But normally our third week co-host, co-guest, whatever you want to call it, is none other than Barbara McIntyre. And she is a reverse mortgage expert who has a lot of skill and knowledge about helping navigate all of that correctly. She's with Reverse Mortgage Funding, and she's always our third guest of the month, third Wednesday of the month. So again, we gather around the radio at 12 noon every Wednesday for Helping Seniors Radio right here on 90.3 FM. Fourth Wednesday of the month is none other than Jennifer Helen, who is the owner of Seniors Helping Seniors, a great service here in Brevard County, and also a great employer of seniors here in Brevard County. And we're always covering good senior information. When Joe Steckler founded the Helping Seniors organization, it was really geared with the intention of getting information in the hands of seniors and the families that love them, care for them, so that we can make good decisions on every front. So I do want to come back. We just mentioned the third Wednesday of the month. That's actually going to be next Wednesday, March 16th. I really would ask if you might put this down on your calendar, because as you heard Dr. Sheldon and I early in the show talking about, Joe Steckler, our president and founder, has really been advocating a lot about what we're finding out to be the number one topic here and need of seniors in Brevard County, and that is affordable housing. And even though housing prices are really looking good if you're the homeowner, they're really kind of challenging if you're the renter, and they can still be challenging if you're the homeowner, because as the property values go up, so does your insurance cost and so does your taxes. So this topic of affordable housing has really become front and center as part of what Helping Seniors does on our advocacy. So literally next week, that's going to be 12 noon right here on 90.3 FM, WEJF. We are going to be tackling that subject together with our friends from the Brevard Commission on Aging. And that is an organization that's actually chartered by our county commissioners. And we meet, it's open to the public every month there at the Government Center in Brevard, and it's led by a gentleman by the name of Dr. Potomsky, who's a medical doctor. He's head of the Brevard County Medical Directors Association, has a tremendous amount of experience in geriatric medicine, and it's a group of like-minded citizens who are there to talk about and advocate on behalf of seniors. So we've actually invited a number of folks from the Brevard Commission on Aging to be our guests next week on the Helping Seniors radio program. So we'll all be together right here in the studio, and we're going to be really advocating. We're going to start the dialogue. It's a complex situation, but one of the first places, if you're going to tackle any challenge, you have to be willing to at least talk about where we are and what the problem is. And that's what we're going to be doing next Wednesday. So I invite you in particular for next week to make sure that you're here and invite anybody that you know. I can't tell you the number of calls that Nancy Deerdorf gets about people who are finding themselves in situations, the housing. I would literally almost call it a crisis, because there's, it's tough enough if you're homeless and you're able-bodied and you're working and all those kind of things. That's difficult to families and all of that. But it becomes incredibly complex when you're fighting aging as well as those things. So make sure you're here for radio next week. That'll be Wednesday, March the 16th, if you're going to write this down, 12 noon on 90.3 FM WEJF. You don't want to miss that. On a lighter note, we want to talk about some good information that is coming up and that's available to you. We're so glad to see things being opened back up after a couple of years of 30 days to stop the spread, which ended up being a couple of years to stop the spread. But the good news is we're actually back. We just finished up our very first Senior Resource Center of Brevard Community Information Series lecture, seminar, or whatever you want to call it, gathering there at Zon Beachside. We meet literally on the last Monday of each month there at Zon Beachside in their beautiful Nautilus Ballroom. Zon Beachside is right there at 1894 South Patrick Drive. Beautiful luxury assisted living and memory care facility. And they're kind enough to open the doors for us to host us with the Senior Resource Center Brevard, which is a collection of like-minded businesses that really try to provide resources for seniors. And so on the last Monday of each month, 10:30 to 11:30 a.m. is your opportunity to join us. It's free. It's open to the public. Zon Beachside provides some coffee, water, nice snacks. It's a pleasant time, and it's literally 55 minutes designed to help you move along in your aging plan. So we literally just completed the first back physical get together since pre-COVID, and thanks to everybody who showed up. But we also, by the way, we record those for television. So we're going to make sure you have a link. If you missed it, you'll be able to meet some of the players in the Senior Resource Center Brevard. And literally, I would like to ask you to put on your calendar March 28th. So March 28th, 10:30 a.m. We hope that we will see you at Zon Beachside in the Nautilus Ballroom, because we actually have Tyler Runty from the law office of Amy B. Van Fossen, and she's going to be talking about some documents you really want to consider making sure that you have correctly, so that as you're making your aging plan, you are in good stead. So we're really excited about that coming up. And again, it happens last Monday of each month. If you want information about this, let me give you a couple of ways to get at it. You can always find out what's going on at helpingseniorsofbrevard.org. That is our website, helpingseniorsofbrevard.org. You can also always give us a call. Our senior info helpline is there to help you. That's a free call, 321-473-7770. 321-473-7770. So important that you take advantage of this. Our theme, as we've been talking about all along, is called Get Your Ducks in a Row for 2022. How about if I say it the right way? So that's our theme, is to help you make that aging plan so that you're well equipped for whatever happens. Here in Florida, we understand a hurricane plan. You don't want the hurricane to come by your house, but if it does, you're going to be prepared. And that's kind of the mindset of an aging plan. We don't want any of these things to pop up, but we're going to have a plan so that we are prepared for just anything that we might run into along the way. And the good news is by taking advantage of the resources that Helping Seniors is connected to, and there are a lot of good resources right here in Brevard County. You just got to know where they are and how to access them. That's all part of your aging plan. So we're going to continue this dialogue. That's about the time that we have for today on the Helping Seniors radio show. We want to remind you, we're getting ramped up for the Helping Seniors car raffle. That's our big fundraiser. As a nonprofit, we can't do this without your donations and your help. If you're not familiar with the Helping Seniors car raffle, visit helpingseniorscarraffle.com. But in a nutshell, somebody's going to get a brand new car on Saturday, October 29th. It's a car raffle for charity, and you should be part of it. Get the details at helpingseniorscarraffle.com or give us a call. Speak to Nancy Deerdorf on our senior information helpline, 321-473-7770. Whether you just want to make a donation, whether you want to get your car raffle tickets, or maybe you're a business that does care for seniors in this area, give a call. Find out how you can get involved in the work of helping seniors. Well, John Harper, that's about it for this show. Thank you so much for listening, listener. We will see you next week right here on Helping Seniors Radio. Till then, on behalf of Joe Steckler and our entire Helping Seniors crew, see you next time.